Just wanted to lead with a couple of data points. And first, just thank you all for your testimony and participation today. It's important and timely conversation, obviously. About 42% of adults, up from 33% just about 5 years ago, say that they have either used fertility treatments or personally know someone who has. And there are currently an estimated 1.5 million frozen embryos nationwide. The recent ruling in Alabama effectively bans IVF in certain states because it would subject people involved in all steps of the process to unreasonable criminal liability. As Republicans continue to stumble over the flawed arguments against reproductive rights, what I see happening is they're realizing that it's one thing to say that you're opposed to abortion in theory, and it's a whole other thing to try to legislate in this new reality. Now, it's offensively hypocritical for so many House GOP members, for example, lining up to pledge support for IVF while simultaneously signing on to so-called parenthood legislation with no carve-out for embryos in clinics. My first question, Dr. Zahedi, how would you square Republican support for IVF with support for personhood legislation like the Life at Conception Act?
So thank you for that question, Senator. And if I'm understanding your question, I think the hardest part about all of this discussion is that reproductive justice is both about choosing when to have a family and choosing when not to, and then the safety around how you choose to parent your children as well. And the argument around IVF, they are, as in conjunction with the argument around why abortion care is necessary medical health care, is that you're taking away the autonomy of families to make the decisions that are best for them. And you're erasing grief and trauma for those families that are having to make decisions that are very difficult. Having known plenty of colleagues as well as friends who've had to undergo infertility treatment, that is a very difficult road for them. And then to have, their time and energy and responsibility taken from them by the state and told what they can and can't do with that is just as scary as what we're seeing with the patients who are coming to us for abortion care.
Yeah, no, and I appreciate the perspective as a physician in this, because for a party that claims to be about rights and freedoms and liberties, they're taking away rights and freedoms and liberties from families across the country. Dr. Myers, can you talk a little bit more about the societal and economic impacts of banning IVF?
Yeah, and I'll preface it by saying, since this has been a bit of a mixture of the personal and professional, my oldest child is an IVF baby and the product of a frozen embryo transfer. This really hits close to home for me, seeing what's happening in Alabama. So reproductive autonomy isn't just about young people avoiding parenthood until they're ready. It's about all people being able to become parents when they want to. And IVF has helped millions of people, including me, and the economic evidence suggests that it allows women to spend more time seeking the right partner, investing in education, and investing in their careers. And in a country and moment when we're increasingly seeing people delaying parenthood, a lack of access to IVF is very concerning from an economist perspective.
Thank you very much. And if I can, in my brief time remaining, I do want to touch on another topic because I think as Dr. Zahedi exemplifies, there across the country are obstetricians, gynecologists, and nurses that are leaving their practices in states like Idaho, Texas, Oklahoma, and Tennessee, while new doctors are avoiding those states altogether. Facing the departure of respected and talented physicians, many hospitals have since closed their labor and delivery units in these red states. So the brain drain extends beyond just maternity care. Following the Dobbs decision, a growing number of companies have updated their health insurance policies to include abortion travel benefits. And it's because they recognize the impact that state laws restricting abortion care have on their ability to attract and retain talent. Dr. Zahiri, can you left Georgia and Tennessee, as you shared in your testimony, as a result of Dobbs and the state's abortion restrictions. I can imagine that Republican attacks on reproductive health care is driving obstetricians and other healthcare professionals from red states. How does this impact access to essential health care services, including prenatal visits, including access to contraception, including maternal fetal medicine and postpartum care, cesarean sections, and more in those states that are being left behind?
Thank you so much for that question, Senator. I have a deep concern for what's going to happen in this country as these rights continue being taken away. We know even prior to Dobbs that states that had abortion care restrictions had worsening maternal mortality and morbidity, and that was still divided and worsened across racial lines as well. So now that we're adding in the factor that physicians are afraid to be in states where there are significant abortion bans, you're eliminating an entire workforce. And in addition, almost 50% of the OBGYN residents in this country are training in states with abortion care restrictions. We will graduate an entire generation of OBGYNs who don't know how to do D&Cs for miscarriage management, who aren't equipped to counsel patients appropriately about the findings of their pregnancies, who aren't going to be able to provide necessary emergency medical care in these communities, and I'm very afraid what that's going to mean for their patients. Idaho, for example, has had multiple maternity wards close over the last several years as almost 25% of their OBGYN workforce has left, and there is maybe 2 maternal fetal medicine physicians left in the entire state. Patients are traveling 200 miles one way for prenatal care now. In a state that already had really, terrible maternal mortality and morbidity. I worry what that means for the residents of that state, and how we're going to continue to watch women die.
Yeah. Senator Kane, and then
Mr. Chair, just in closing, because obviously we have and will continue to have fiery debates as policymakers, and we're seeing what impact it's had on medical professionals in states across the country. But the ultimate consequence, and this is why you're having this hearing, the ultimate consequences are on women and families, and that needs to be at the center of our actions here. Thank you.